Thanks very much, Michael, and thanks everyone for the opportunity to come up here and speak to you today about the Southern Pearl resource. So, Southern Pearl, Pearl standing for the Palliative Education and Resource Library. So, why did this begin? Why did we start this project? Well, whenever I first came into post, there was an investigation opened in relation to a potential SAI that was seen in care homes. So there was syringe pump had been alarming whenever district nurses arrived to remove it following the death of a resident during the night previously. Following the investigation with interviews, it was reported back that there was no apparent indication during the night that the patient was in pain. However, the syringe pump was alarming and nobody could guarantee that the patient was receiving the medication that they were due to receive and was prescribed, hence why an SAI investigation was opened. The indication or the feedback came that the staff who were there to look after the syringe pump and inevitably look after the patient who had the syringe pump felt that they weren't seeing syringe pumps often enough to feel entirely confident and then competent in the management of these and addressing issues when they arose. And because the patient didn't look to be in pain to them, they decided they would let it alarm until somebody came along who inadvertently felt confident and able to look after it. So this was decided it needed to be addressed and addressed as soon as possible. And the decision at that point was maybe some bite-sized videos that could be in the care homes for them to utilise and use for if somebody was coming in on a syringe pump to then refresh staff and increase confidence. That feedback and that decision, in addition to education being a high priority within the Southern Trust, the need for further standardised education because there was so much out there and so many different areas, sometimes finding it contradictory and sometimes finding it very confusing. Therefore, we felt we needed to standardise something and have something to try and hold it all together. Care home staff feedback had obviously fed back they needed more. We had feedback from individual teams, and then we went out and got feedback from the independent care home sector and care home domiciliary care providers that they felt they needed further standardised education again to help with that confidence managing patients when they were most vulnerable. So whenever we were dealing with that with an SAI pending, with that amount of feedback, you proverbially begin to feel like this. And I think it's something that a lot of us can familiarise ourselves with, that there's many times in healthcare at the minute we feel we are behind that elephant pushing it up the stairs. So what do we do? And to manage feelings like that, it's always better to come around and sit together. And there was a definite strength in numbers, seeing that everybody was there to help and work through this process. And there was an understanding that everybody who came to the room, everybody who said they wanted to help this process had something to offer. And whenever I first seen this image, and that's why I sort of kept it in, I always felt like everybody was sitting around the table looking for that one piece of the puzzle to put it in the middle. But it actually worked out if you use all the pieces and extend it out, you're still growing your support network. There's still growth in what everybody has to offer. And even if it isn't that one single nugget or that one piece in the middle, it might fit around the edges and grow the project bigger than you actually think it's going to be anyway. So we sat down, we came together and we decided on agreed aims, and I suppose from all our leadership talk and all our quality improvement talk, we talk about shared objectives and shared vision and going together. So we had to have a couple of aims that everybody agreed and bought into. And I suppose our aims were providing an accessible educational resource for professionals in key areas related to palliative and end-of-life care. Again, as we said, to try and increase that confidence and make sure people felt competent. And then the secondary aim was use a similar format to provide an accessible educational resource for the service users that were out there, because there is always that ongoing feeling that we feel they should know what we provide and what they feel we provide isn't always matching up. So to try and close that disconnect, we wanted the two to marry up. When we provide a new resource for our professionals, we provide an update resource for our patients so they would know what was available and what it all meant as well. And with them three things, we felt we were trying to connect, communicate and inform. And try and remember them three pieces for later on. We will come back to connect, communicate and inform. So as with anything, what next? We're always on this road and journey together. And I picked up on this quote recently as around the most dangerous phrase in the language is "we've always done it this way," from Rear Admiral Grace Hopper from the US Navy. And we need to consider different ways to do things. We've been trying to increase our access to education, and we've been talking about education for a long time now, but we're still having the conversation. So we maybe need to look internally at ourselves and think, well, we need to accept we might need to do this slightly differently, but slightly differently together. So what actions did we take? How did we do this? So a working group was set up. We reached out across the team, reached out across community and voluntary sector, and we 19 different teams put their hand up to say they wanted to be involved in this project. Questionnaires were shared with the services that wanted further support. So originally the questionnaire that you see on the right hand side there was shared with the care homes, looking at trying to see where they felt they needed further information, where they felt vulnerable, and was there a disconnect between confidence and competence. And then we needed to see, when we looked at what needed to be provided, how we were going to actually provide this going forward, how we were going to share it in a way that was useful, usable, and close that gap that we felt was out there at the minute. So we looked at different resources. There was talk, and the care homes had came to us and said they wanted to look at, or had been asking for, an education resource, a palliative care folder to keep in their shelves and have in the homes. When we talked about this, the feeling was the more folders you have, the more chance of unstandardized information or inconsistencies or out-of-date versions there was going to be, and many homes will get lost and not taken off the shelf again as well in different places. So we felt an electronic version was good. We looked and found Page Tagger was out there, and it meant that we could use something that we could control centrally to keep on top of version control. It was accessible outside our trust interfaces. It went past the trust firewalls, and then it was accessible on both computers and smartphones, leaving it accessible at all times, regardless of the, I suppose, the environment you're in and trying to access it. So the outcomes were 89% of respondents requested areas of further training, and then this questionnaire was shared with and rescoped in paediatrics for the second part of the Pearl project, and we had a further increase in respondents looking further training. The working group was split up into areas of training or information required. So because we had so many teams came forward, we looked at each specialism sorting out their own page. So it was the experts providing the expert information. So for example, district nurse, we're looking after the syringe pump information, dietetics, nutrition, TVN, we're looking at skin, pharmacy, we're looking at meds, and so on and so on. And a combination of different presentations, documents, leaflets, and videos have all been included. And then that is shared across the trust regularly, shared outside the trust with the care homes, and now been shared with the independent dom care providers as well. And to date, from what's been released, it's been accessed almost 4,000 times, and on review again this week, it's still been accessed on almost daily basis from what first got published. So the topics that are included, and again, I'll not go through all of these, but just to show that there is a wide-ranging set of topics, and I've colour-coded a few different things here to show you the colours that are the same. So the likes of the green for recognising end of life shows us that there's consistency throughout the information being provided. With Pearl A, it's for the professionals working with adults. For example, looking at recognising end of life, there's a version in the children's one for professionals working with children. That's a slightly softer video. And then there's the exact same one recognising end of life in Pearl P, which is going to be our version for the public, but again removing medical jargon, patient information leaflets, information that's relevant and useful for them, and closing that disconnect between what our professionals know and with what our patients have to use as well. The pieces at the top that are underlined are to highlight that the information that's earlier in each of the resources are the information that came through and more frequently requested from the questionnaires. So the feedback from the staff was taken on board. It was seen as really, really important, and we made sure that it was able to be accessed earlier within that resource. Although to try and counteract if people needed stuff that was further in, the contents page is interactive as well. So once you scan the QR code, hit what you want from the contents page, it'll automatically bring you through to the section you want regardless of the time or where you are. So the resources themselves, I say Pearl A is the one for professionals working with adults. It's accessible via QR code, or it has its own unique URL, and there's a poster for it as well. And the exact same for our children's version for professionals working with children. Anytime we update it or change any of the information, the QR code stays the same and the URL code doesn't change. So once you have it, you have it. And the idea is now that it's gone onto a poster, we're going to request that wards, teams, services included in their induction folder. So then there's a prioritisation around access and palliative and end-of-life training, and that'll tie into some of our NACIL, National Audit of Care end-of-life recommendations around prioritising education for healthcare professionals and increasing the accessibility of it going forward. So again, what next? I say every journey continues as we go. So Pearl P is due for release in November. We're finalising the last pieces of it at the minute, but I feel like I've actually been saying that for a wee while. The reason that it has been delayed and stalled is, as any good project and as we bring anything towards the public, we've been utilising PPA, and the patients and the members of the public who've came involved has told us they really like it, they do like the idea, but tell us how we get what we need when we need it, whether that's during the day or whether it's at night time. So the very first couple of pages of Pearl P, before it gets into the different levels of information and the different symptoms and stuff like that, is going to be nearly a ready reckoner of how I access what I need to access and when I need to access it, to leave it easy at the point of requirement for our patients. There's then the discussions around having the likes of a Pearl D for dementia, because obviously within other specialities there's other factors we need to take into consideration. So we're going to look at trying to make some specialised versions for different areas and grow them, the number of Pearl resources that are out there. And then there's ongoing discussions around how we can use parts of it regionally. We're sitting within the task and finish group of the regional palliative care and partnerships task and finish group on education as well. And then we're always reviewing the Pearls that have been published, the ones that are in use, and making sure that we have the most up-to-date information in there as well, and we aren't missing stuff that has been more, I suppose, more recently updated. And the last couple of slides sort of show or highlight the importance of this. And I suppose, again, this quote from Kofi Annan, who was previous General Secretary of the UN. So again, definitely much more educated and intelligent than myself, therefore probably better to use his quotes than mine. So knowledge is power, information is liberating, and education is the premise of progress in every society and every family. And I suppose what I've taken from this one is, we want people to have the power, we want them to have decision or choices, we want to feel free to make the choices that we need to make, and as a society we want to continually progress, so never underestimate the importance of education. And the last slide to finish on is a slide that I actually used in a completely different presentation recently and used it for a different way. And the idea of this is a cord of 3 strands may not be easily broken. So one may be overpowered, 2 can stand up for themselves, and a rope of 3 cords isn't easily broken. And the whole idea of this was around speaking, being together, creating connections, being stronger. 3's better than 2 and 2's better than 1, but the more we have, the stronger we are. But in this I genuinely seen, and then if we look back to the earlier slides, the cord of 3 is the connecting, the communicating and informing. And if we continue to connect, we continue to communicate, and we continue to inform our professionals and our service users, then we're going to be in a stronger place than we are without any of them. Thank you.